This is the news in brief from the United Nations. The UN Joint Sustainable Development Fund on Monday announced an historic expansion to help ensure the world gets on track to meet the 2030 Sustainable Development Goals, or SDGs. Proposals for projects from Kenya, Madagascar, North Macedonia, Suriname and Zimbabwe were chosen by the fund from more than 100 submissions, emerging as the strongest, most impactful and investment-ready. The $54.5 million funding boost constitutes an ambitious and concerted response by the UN to the challenges of our generation, from COVID-19 to youth empowerment to climate change, said the fund. UN resident coordinators will be tasked with getting the programmes up and running across the 5 nations, ushering in a new generation of collaborative action between the UN, governments, civil society and private sector investments. This announcement comes less than a year after the fund launched its first investment of $41 million in 4 transformative programmes in Fiji, Indonesia, Malawi and Uruguay. More than 90% of the 45,000 people displaced by hostilities in and around a large prison in northeastern Syria 2 weeks ago have now returned to their homes, said the UN Humanitarian Affairs Office, OCHA, on Monday. The offensive near to Al-Hasaka, launched by terrorist group Daesh or ISIL on the Al-Sina prison complex on the 31st of January, was successfully beaten back after days of siege by US-backed Kurdish defence forces, although security and search operations continue. As of the 6th of February, one displacement centre continues to host approximately 20 households, and a further 2,000 people are estimated to be living in host communities. Main obstacles to return include the damage or destruction of homes, shortage of basic services and food items, and restrictions on movements due to ongoing security operations. And finally, a week after tropical cyclone Batsirai hit the southeast coast of Madagascar, the death toll continues to rise. At least 121 people have lost their lives, including 87 who reportedly died following landslides in the mountainous district of Ikongo, according to the country's disaster management agency. More than 29,000 people remain displaced across 79 different sites, and nearly 19,000 homes have been destroyed, flooded or damaged, said a news release issued on Monday on OCHA's Relief Web platform. More than 133,000 children have lost access to schooling, while more than 4,500 classrooms have been destroyed. At least 69 health facilities have been affected, including the district hospital in the east coast town of Mananjarai, which is currently not operational. Relief efforts are being scaled up while the government's repairing basic infrastructure. Local communities and authorities are on alert as a new tropical depression is forming in the Indian Ocean, heading towards Madagascar. Matt Wells, UN News.
This is the news in brief from the United Nations. The UN Children's Fund warned on Tuesday that more than 1.4 million children in Somalia, or nearly half the country's under 5 population, are under threat of acute malnutrition. According to the latest Somalia Food Security and Nutrition Assessment, the ongoing drought has left 4.1 million people on the brink and around 329,500 children likely to suffer from severe malnutrition this year. UNICEF representative Angela Kearney said that the alarming numbers meant that thousands of children risk death unless urgent action is taken. 3 consecutive seasons of failed rains, combined with ongoing conflicts in many parts of Somalia, have left a quarter of the population grappling for food assistance. And the humanitarian situation facing poor and displaced populations is expected to deteriorate even further between now and June. UNICEF is urgently appealing for $7 million before the end of March to procure ready-to-use therapeutic foods to treat children with severe acute malnutrition. Turning to Singapore, the UN Human Rights Office, OHCHR, on Tuesday urged the government to halt the imminent execution of 2 men who have spent the last 14 years in jail convicted of drug offenses. According to spokesperson Ravina Shamdasani, Raslan bin Bakar and Pauzi bin Jeffreden were arrested in 2008 and convicted in 2010 on charges of drug trafficking. Having lived for the past 12 years on death row, only last week they were reportedly informed of their imminent execution, which is scheduled for Wednesday. Ms. Shamdasani reminded that the death penalty for drug-related offenses is incompatible with international human rights law and should only be imposed for the most serious crimes. Moreover, the death penalty has not proven to be an effective deterrent, while some facing execution, as well as their families, have suffered a range of human rights violations. OHCHR called on the government to commute their sentences and bring an end to the death penalty. The World Health Organization on Tuesday published a new, easy-to-use guide on COVID-19 recommendations for pregnant women, including transgender men and other gender-diverse people who may have the capacity to become pregnant. Produced in Q&A format, the recommendations include the vaccines which have been approved by WHO for emergency use, including while pregnant, which cover Pfizer, Moderna, AstraZeneca, Janssen, Sinopharm, Sinovac, CoronaVac, Bharat Biotech, and Novavax. All the vaccines are expected to work as well for pregnant women as those who aren't expecting. WHO acknowledged that although pregnant women were not included in the initial clinical trials of COVID-19 vaccines, evidence on their safety and effectiveness in preventing severe illnesses, hospitalization, and death during pregnancy has increased. And given the substantial risks from COVID-19 during pregnancy, WHO maintains that it is critical for pregnant women and those planning to become pregnant to have access to emergency-listed COVID-19 vaccines as soon as they are available. Liz Scafidi, UN News.
This is the news in brief from the United Nations. The Global Disabilities Summit began on Wednesday in Oslo, where UN Secretary-General Antonio Guterres urged all countries to do more to put people with disabilities front and centre of their post-COVID recovery plans. In opening comments to the meeting, the UN chief insisted that people with disabilities were often the poorest and most disadvantaged members of society. Those with disabilities were dying at vastly higher rates, Mr Guterres said, all because they faced persistent barriers in health systems. In developing countries which are strangled financially, he also noted that people with disabilities were among the first victims. According to the UN's Children's Fund, UNICEF, there are 240 million children with disabilities in the world. The UN Population Fund, UNFPA, meanwhile, said that women with disabilities were up to 10 times more likely to experience sexual violence. More than 8 in 10 people in Africa still haven't had a single COVID-19 vaccine dose, the head of the World Health Organization, WHO, said on Wednesday. Speaking at an event in Germany in support of coronavirus vaccines for all African nations, Tedros Adhanom Ghebreyesus condemned the rampant inequity that is undermining efforts to bring the pandemic under control. Tedros warned that in many countries with high vaccine coverage, a dangerous narrative had emerged that the global health crisis is over. But with 116 countries off track for vaccinating the WHO target of 70% of their populations, Tedros warned that conditions remained ideal for new variants to emerge. To Cambodia now, where top UN-appointed rights experts on Wednesday criticised government COVID restrictions on casino workers that have disrupted their strike action. Staff from the 365 Naga World Casino Resort initially downed tools in December over claims that employees had been dismissed unfairly. That the strike ended earlier this month after the government said that one of the picketers had tested positive for the coronavirus. Several hundred striking workers were then transported to a makeshift testing site, and many are still waiting for the results of their second COVID test. The rights experts criticised the sluggish test results procedure, which they said shows the lengths that authorities may be willing to go to thwart workers' rights. At least 35 union leaders and activists have been arrested since the strike began in Cambodia, where the rights experts described the restrictions on strikers based on public health concerns as unjustified, unnecessary and disproportionate. Daniel Johnson, UN News. This is the news in brief from the United Nations. With up to 14 million people on the brink of starvation in the Horn of Africa, the UN on Thursday hailed a $20 million donation from Germany to save lives and livelihoods. The Food and Agriculture Organization, FAO, which warned that an extended multi-season drought has caused crops to wither and animals to weaken, said that the situation could worsen further if more aid is not forthcoming. In total, the UN agency's Horn of Africa Drought Response Plan requires more than $138 million. This will be used to help rural communities in Ethiopia, Kenya and Somalia by providing access to food and other basic goods and services, including water for animals and irrigation, veterinary services and education. Communities will also receive assistance to protect and restore their livelihoods and to improve self-reliance against drought. In Madagascar, child sex abuse is widespread and tolerated in tourist hotspots, UN-appointed rights experts said on Thursday. In a call to the authorities to take action to protect youngsters from child prostitution and other violations, the UN Committee on the Rights of the Child heard that the majority of children who had sex for money did so to survive. To combat this, the Geneva-based panel urged Madagascar's government to strengthen multilateral, regional and bilateral accords to prevent sex tourism. Its recommendations followed a scheduled rights review of the Indian Ocean island nation, which in 2004 committed to eradicating all forms of violence against children, including sexual abuse and exploitation. During exchanges with the Malagasy authorities and civil society in Geneva, the UN panel noted the extreme vulnerability of communities affected by recurring drought and chronic shortages of water and food, particularly in southern areas. Linked to this, rates of acute malnutrition among children have worsened exponentially in Madagascar, said the UN-appointed independent panel, which oversees how member states implement the Convention on the Rights of the Child. In its submission to the panel, the civil society group ECPAT International explained that child prostitution has become trivialised in Madagascar and is conducted openly in bars, nightclubs, massage salons and hotel establishments. It said that while more than 250,000 tourists visited Madagascar, according to latest data from 2017, the majority of abusers were citizens of the island nation, with most affected areas being the capital and coastal towns. To Sudan now, where it's been confirmed that the delayed official visit by top UN rights expert Adama Dieng will go ahead, a month after it was put off at the request of the authorities. Mr. Dieng, who is the UN expert on human rights in the Sudan, is scheduled to arrive in the country on Sunday, the 20th of February. During his 5-day visit, Mr. Dieng is expected to meet with senior Sudanese government officials, representatives of civil society organisations and human rights defenders. The development comes after repeated deadly street protests across Sudan that were prompted by a coup last October after the overthrow of longtime President Omar al-Bashir in 2019. In response to the military takeover, the UN Human Rights Council passed a resolution that led to the appointment of Mr. Dieng to monitor the situation in Sudan until the restoration of its civilian-led government. Daniel Johnson, UN News.